I was like 9 months pregnant, and I was listening to music and I was crying on the train on the way home, and I felt like Mary, who was pregnant and didn't have a place to be, you know? I remember even being at screenings at the mall or being at places and just kind of loathing the time when I would have kids, because I would have to be there on a Saturday and like trying to get new patients. And I guess for me, one of the fears that I have that's an ongoing fear is more money, and fear that I'm not going to have enough money, and it's just not going to be there, and then the world's going to end, you know. Like, I started practice, my current practice, just 2 months after having my first baby. And I remember like freaking out just because I was so tired and having a hard time thinking I was doing everything by myself. And I called one of the warrior women, like crying, and I talked to her and I talked to her husband, and they both like just explained to me like, this is normal, this is okay. And it's just like, I couldn't have called my mom or a friend because they don't understand the same way. Compared to being in school and being in practice, I was surprised that you can actually see that many people and still help them. Because in school, they just teach you that, I don't know, you go in clinic and you have to spend half an hour with the patient, or that's what you block. And that's good quality care, right? So I was really surprised in the beginning that you can actually do your job in just a few minutes if you're doing the only thing that really matters. The first year that I was practicing, I was an exam doctor, and I made $35,000 in the first year. And then the first month of practice, I collected $29,000. So it's a big surprise that could happen. But really, it just never went back. Like, it was just always more and more people starting and advancing and helping more and more people. So I guess for me, it was surprising to see that it's doable to do that and to do it well. Yeah, there's no way I'd be seeing the same results if I wasn't a warrior. That's for sure. And the proof is even in just myself. Like, my whole life, I had headaches and back pain and my own sort of health struggles. And having seen a chiropractor literally for 20 years before I met my first corrective chiropractor, I mean, I would have still had those problems, right? I was just keeping them at bay. And it only took a year of corrective care to get rid of all those things permanently. And that was a huge realization for me to be like, wow, this is what chiropractic should be, and this is what I should be doing. Lots of things keep me a warrior. I would say what it has become is very much the community that keeps me a warrior. The bonds and the friendships that I made. It's really cool because a lot of my friends now are people in Warrior, and we have all these things in common, and we can spend time together and just be 100% real and ourselves and tell each other what we want to say. And I think that's amazing, and you can't find that in a lot of places. There's not a lot of women doing what we do, so having role models and people to go to when we're struggling with something. So yeah, I used to not want to risk things or put myself in a situation where things could be unpredictable or scary. And now it's funny because I'll recognize when something scares me, and I'll be like, sweet, I need to go there. And that's really fun. I'm not saying I'm not afraid, because I'm afraid a lot, but actually enjoying that because I know that I can move past it. And it's not from God, so that it's okay to go beyond it. My name is Emilie Perras, and I am Warrior.